Top 20 doctor interview questions and answers. Doctors are trained to diagnose illnesses, treat, and administer the right medication. An individual needs to have relevant skills, knowledge, and experience to perform the role of a doctor effectively. If you are a doctor looking for a job, you need to be adequately prepared in order to ace the interview. Interviewers ask questions aimed at assessing whether you are the right candidate. This article explores questions that are asked often during a doctor's interview. It also includes sample answers to ease your preparation. 1. Why are you interested in this role? The interviewer wants to know why you want to work in their hospital. Sample answer: my aim in this profession has always been to perform my duties excellently. And through my research on your hospital, I realized you are among the country's best hospitals with modern equipment and facilities to serve your patients. I, therefore, see this as an opportunity to serve people diligently using your modern support and equipment. 2. What are the unique skills that differentiate you from other doctors? The interviewer intends to know the special skill which differentiates you from other doctors. Sample answer: I care a lot about people's lives, and I am always cautious and extra careful while treating them. I never treat a patient based on assumptions then predict the medication. I always conduct lab tests on the patient to ensure the conditions they have, after that, predict the appropriate medications and ensure they take them accordingly. 3. Where do you see yourself in the next 5 years? The interviewer wants to know what you want to pursue in the future. Sample answer: I will have acquired significant skills and knowledge in the field such that I will be able to handle more complex roles. I also envision myself being able to handle more managerial roles. Moreover, I plan to enroll in further studies to enhance my skills and expertise. 4. How do you handle emergency and workload? The interviewer wants to hear how you work in an emergency. Sample answer: my patient's life comes first before anything else. Therefore, in case of an emergency, I will first deal with the patients and ensure they are fine. After that, engage in the formalities. I will inform the manager, together with the police, of what has just happened to take immediate action. I also know my duties, and I ensure no work is left untouched by the time I finish my shift. 5. How did you get to know about the position of a doctor that we are offering? The interviewer intends to know how you became aware of the position. Sample answer: for a long time, I have always wanted to work in this hospital. Thus, I always follow your pages and constantly check about the job scenario. I am conversant with all the hospital rules and regulations. I also know how you operate and how you handle your patients, which amazes me, and I wish to be part of your team. 6. Are you willing to travel in case the job demands you to do so? This question mainly tests your flexibility. Sample answer: in addition to saving people's lives, I also enjoy traveling. I can travel anywhere in the world to ensure my patients get all the treatment they need and are safe. Additionally, while traveling to new hospitals, I also learn new skills, which I implement in my job scenario. 7. How can you contribute to our hospital? The interviewer wants to know how significant you will be to their hospital. Sample answer: I will treat patients according to the best of my ability to ensure the hospital's reputation remains to be good. I will always be careful and ensure I don't do anything that may harm the patient and decrease the hospital's value. Additionally, I will always research the medical industry's new advancements and inform the manager to work on them to ensure the hospital remains at the top. 8. What are the roles of a doctor? The interviewer wants to hear the duties of a doctor. Sample answer: a doctor mainly restores the lives of their patients using medicines. They examine the patients for any illness, review their medical history, diagnose the illness the patient has and give them treatment. The doctor then educates the patient on their health and well-being. They also collaborate with other doctors to improve the quality and safety of patient care. 9. What are the qualities that a doctor should possess to be effective? The interviewer wants to know the characters that an excellent doctor should have. Sample answer: an effective doctor should be empathetic and caring to save the lives of the patients professionally. He or she should also be skilled in their field of specialization and use evidence, intuition, and method to ensure faster services to the patients. The doctor should also keep their patient's medical history private and not share it with anyone else unless they allow it. 10. Describe your daily routine as a doctor. The interviewer intends to hear how you manage your daily activities. Sample answer: I start my day by organizing all the workloads, undertaking patient consultations and physical examinations. I then perform surgical procedures if needed and also lab tests for some patients. After that, I offer general pre- and post-operative care to the patients, then monitor and administer medications. Additionally, I assess other patients and plan their treatment requirements. 11. Describe briefly about your experience as a doctor. The interviewer wants to know about your experience in the medical field. Sample answer: I have over 15 years of experience as a doctor. I have worked with Hospital A and Hospital X, where I acquired all the skills in medicine. I am good at examining, assessing, and diagnosing patients for their illnesses. I follow all the rules and regulations in the medical field to avoid messing up in my role. I also exercise great professionalism in my work and collaborate with my team to give patients faster and effective treatment. 12. What kind of mindset and strategies is required for this role? The interviewer wants to hear the strategies you employ in your medical field. Sample answer: a doctor needs to constantly research new medical advancements to ensure they give good and effective treatment. He or she needs to be curious to know new trends in their field and implement them. The doctor should also be compassionate and ensure to save as many lives as possible. In addition to this, he or she should work together with colleagues to ensure they offer excellent treatment to their patients. 13. What is the biggest challenge you foresee in this job? The interviewer intends to know the challenge that you anticipate in the job. Sample answer: the major challenge I anticipate is a considerable number of patients. I understand this is one of the best hospitals in the country. Thus, many people will be coming in for treatment. Hence it calls for extra efforts and being faster and efficient in my duties. That isn't a course of worry since I have all the skills relevant to examine, diagnose and treat patients effectively. I will ensure I treat all patients with all the care and professionalism without discriminating. 14. How do you stay motivated at work? The interviewer wants to hear what motivates you to continue working. Sample answer: my major source of motivation is to make a difference in people's wellness. I am always at peace when I save a life, and when I make my patients feel better. My primary desire is to help certain people such as the elderly, children, diabetic, and indigent. I always feel happy and motivated when I see a patient recovering from a very critical condition. My main aim is to ensure every hospital I work in becomes recognized as the best in its services. 15. Describe a time you failed in this role and the lessons you learned. The interviewer wants to know a time you didn't execute your duties effectively. Sample answer: on a certain chilly morning, I got late to work due to traffic inconveniences. The hospital was packed with lots of patients, and I knew I would have a tough day. I immediately got to work and started diagnosing the patients while administering the medication. Along the way, a certain rude relative to one of the patients was so impatient and kept telling me that I don't know my duties. I'm slow and I should serve them first. I got furious and declared them the last patients I was going to serve. They were so annoyed and left the hospital, of which the manager was so furious for losing a patient. Immediately, he summoned me and explained to me that I had not followed the rules of the organization. I apologized and learned never to repeat the action. 16. Describe a time you demonstrated commitment to your job. The interviewer wants to know how you showed commitment to your work. Sample answer: on a particular day, I had a daytime shift. The patients were numerous, and by evening, I wasn't done. Unfortunately, the doctor who was to turn in for the night shift wasn't feeling okay, and no other doctor was willing to stand in for him. I looked at the helpless patients and decided to stay for the night shift despite being worn out. I tried my level best and treated all the patients, and the manager was so pleased with my action and ended up awarding me. 17. What major challenges did you face during your last role? How did you handle it? The interviewer wants to know the problem you encountered in your previous role. Sample answer: the major challenge was dealing with mentally ill patients. They tend to be violent, and if not careful, they may end up hurting. It becomes difficult to instruct them on doing something. Hence, I had to use force, to which I don't like. Additionally, there was a lack of cooperation from other doctors. Hence, it made it difficult for me since the workload became too much, and I had to strain to achieve my target. 18. How do you deal with a conflict between you and your colleague? The interviewer wants to understand your conflict resolution strategy. Sample answer: at one particular time, while going through the medical reports of a certain patient, I realized the drugs the doctor had prescribed had some problems. I called the doctor and tried to reason with him about the prescription, of which he wasn't ready to listen, and concluded that his prescription was right. I couldn't leave the case at that point. We went to the senior doctor with a complaint, and on evaluating the results, the doctor concluded that I was right and explained to my colleague how he messed. He realized his mistake, apologized, and thanked me for correcting him. 19. How do you react to a stressful situation? The interviewer wants to know how you deal with pressure. Sample answer. The medical field isn't always smooth. There are times when the workload is so much, and there is pressure to complete it on time. The workload may result in stress and a lot of pressure. Thus, in such a case, I always take a 30-minute break to go to the gym where I exercise. The exercise relaxes my muscles, which in turn relaxes the mind. After that, I shower and became fresh and active enough to handle any situation. 20. How would you prescribe medication to a patient? The interviewer wants to hear how you prescribe medicines. Sample answer. In the prescription form, I write the patient's name and age. After that, the medication, its strength, the amount the patient should take, and the frequency. I also write the amount she should take from the pharmacy and the number of refills. After that, put my signature on the form. Conclusion. To pass your interview, you need to be prepared physically, emotionally, and mentally. One way to get ready is to practice these questions and answers. The nature of a doctor's role is unique and specialized, so any employer will be careful to hire a person who understands all the areas of this role.